Welcome back to the Rewind Report. Today we're going to be talking about under eyes. Under eyes is an area that many of our patients have concerns about, and there's many reasons why somebody would not be happy with their under eye. Reasons range from volume loss, pigmentation, skin quality, genetics, positions of the fat pads. And so as an aesthetic provider, it's really important that we know when certain treatments are appropriate for certain under eye conditions. And believe it or not, we actually say no to the under eye more often than not. Many people want that like quick fix, which is usually a filler, and there's a very specific candidate where under eye filler is going to be a good treatment for.
Yes, because if you have any swelling, any fat bulging under your eye, if you have allergies, if you eat a lot of salt, your hormones, multiple things factor in a puffy under eye. And for us to put filler there, the product, hyaluronic acid that they make filler with, can attract more water on top of what you already don't like. Right, Megan?
Yeah, and it's a tight area that has a lot of lymphatic congestion, and so if you're somebody that has any sort of, like she said, allergy prone, or when you eat salty food you swell, or say you go out on a binger and you wake up the next day and you're puffy or swollen, those are just key indicators that you might not be the best candidate for filler in that area.
Yes, but there's so many other things that we can do. So probably one of the biggest procedures, would you guys say, would be Easy Gel?
For sure.
Yeah, so Easy Gel is a great one because it's your own byproduct of your own hemoglobin. So your body is not going to unrealistically absorb water in that area. There's very little downtime, and it actually looks really good. It's a gradual build. Usually you need 1 to 2 treatments, and it will look really nice.
Just to touch on Easy Gel, a big reason why it's such a good treatment for the under eyes is because the under eyes present themselves in many different ways amongst clients that come in. It is one of the most complained about area. Under eyes, jowls, and the turkey neck are like all 3 top things that clients
People
come
hate.
in and point at.
Yeah.
Because those are all 3 areas that I think either make you feel like you look older or look tired, or just unwell. But with the under eyes, there's more things to assess than just that under eye bag or the hollow. There's also skin quality issues in that area. The skin's very thin. There's not a lot of subcutaneous fat under the skin in that area. It's really just skin, a little bit of muscle, and then bone. And so Easy Gel, although it can create some volume over time, it also impacts the skin quality pretty significantly.
Yeah. Similar to what Megan was saying, how you're addressing the volume and also the skin quality, I find that my best results with under eyes are when I use multiple modalities. So often that includes doing some microneedling, because that's actually going to build collagen. It's going to thicken the skin, brighten the skin. Also doing something under the skin like an Easy Gel or a PRF. Skincare at home as well, using skincare that has exosomes or growth factors, that's also going to improve the integrity of the skin. So when you target the under eye with multiple modalities in different ways, that's how you're going to get the best result.
Yeah, absolutely. And I would say all 3 of us sitting up here have tried them all, because just like you guys, we all have also had concerns with our under eyes. Probably from working in healthcare and not sleeping, stress,
being
bad
old,
diets.
Older.
She's not old. Older.
Yeah, hormone
we've tried
imbalance.
them all.
Yeah.
So when we speak about the treatments and the results you get, it comes from personal experience as well.
I've had 3 sessions of under eye filler, and I've had them all dissolved, all 3.
And she had all of the complications, like the tindling, where you get a little bit of the blue hue, the puffiness.
Yeah, it was horrible.
She looked like you go in to think you're going to look more rested, and all of a sudden you now have a new problem.
You wake up in the morning and you look like a giant orb.
Yeah.
Yeah.
I never really like to just jump straight to filler with the under eyes. I think you at least have to improve the skin quality first, and some people even have pigment under their eyes, and that's addressed in a completely different way.
Yeah. So, and there's way better long-lasting treatments that you don't have to come back, because getting it dissolved, it almost doubles the problem that you had in the first place, because now your skin is dehydrated, you look really tired, and now we're starting from square one, and you're out filler, cost, and time.
Yeah, I do like to say we've done PRF and Easy Gel, and you're still like not super excited about the results because it is really gradual. Sometimes doing a lower face Nefertiti, like a Botox in the platysma and the platysmal bands, you'd think it sounds crazy, but it can cause a shift in muscle pull where your depression muscles of the lower face are kind of turned off, and we're allowing the cheek muscles that are levator muscles to kind of win the tug of war pulling, and it does instantly help your under eyes. I also think if you did want to use a little bit of filler, a very minute amount, you don't have to use a lot. You can place it kind of below where the under eye is and where the ligament is in the mid face, and just a tiny bit of filler there supporting that ligament, nowhere near the under eye hollow, instantly supports that area. So there's ways to treat the under eye even without treating the under eye.
Yeah,
Absolutely.
very good point.
It is shocking at how much a little bit of volume in the mid face will really improve the under eye. So even with Easy Gel, a lot of times we'll put Easy Gel in the under eye, but we'll also put the Easy Gel in the mid face, just complementary, and that enhances the result a lot.
Yes, so bring your under eyes to see us.
Yeah.
And we'll fix them.
Yeah.
Yeah.
Over
tried,
time.
Over time, in a
We've-
nice way.
We've tried it all, so we will be very honest.
Yeah,
And maybe tell you no.
in a nice way. We might tell you no.
All right, well, we'll see you guys next week.
Yep.
See you next week.